Almost 6,000 local healthcare workers will soon undergo mandatory training to help make their organizations more inclusive. It's part of Wake the Giant's new Indigenous cultural and inclusivity training, which is the result of 2 years of preparation and consultation. Vasilios Bellows explains.
It's a big step towards equal health care for all in Thunder Bay. Both the regional hospital and St. Joseph's Care Group have announced their employees will be taking part in a new virtual Indigenous culture and training program. The training was created by officials with Wake the Giant and developed by the Northern Anishinaabe Education Council. Around 5,900 employees and volunteer workers in the city will learn how to identify systemic racism in the healthcare sector while learning more about Indigenous culture, history, and traditions.
Providing them with the background of what it really feels like when people don't understand where we come from or who we are, and being given that opportunity to take the time you need to share with people is such an important part of developing something that is going to educate people on who we are as Indigenous people.
Many from Indigenous communities across the region come to the regional hospital for care, meaning their first impression of the city is in the healthcare sector. Hospital President Rhonda Crocker Ellicott says that's one reason why she wanted this training for staff, with many employees already seeking these opportunities.
Our staff believe very strongly that this cultural safety training is really important and have been asking for something like this that could be across the entire organization, not just for a few people, for everybody coming to the same place. And for us to be able to create an environment where people feel safe, that's our priority.
Over at St. Joseph's Care Group, President Kelly O'Brien explains what this will mean for her organization.
I'm making mandatory training for 2,200 of our staff to complete the online module, but more importantly for us, it's part of our process as we walk with humility to create a culture where everyone feels welcome and with respect and dignity receive their care with respect and dignity.
It's expected that all healthcare employees and volunteers will complete the virtual training by March of 2025. Vasilios Bellows, TBT News.